Good morning, I'm Dr. Deuk at Deuk Spine Institute, and I have with me one of my patients who underwent a Deuk laser disc repair, endoscopic repair of, how many discs did we fix in your back?
Three.
3 discs. So you had 3 herniations and pain was coming from 3 discs. And tell us about that pain today. You're 6 weeks post-op. Do you have that back pain anymore?
I do not. It was gone immediately post-operative. I had no pain in the back at all.
So you're saying back pain is curable?
It is definitely with me.
Okay, great. That's exactly the point we're trying to make. People don't have to live with back or neck pain. It is curable nowadays. This is 2019. It's been curable here at Deuk Spine Institute for the last 15 years. So we're trying to get the word out. What kind of leg problems were you having before surgery?
I had a deep aching pain down both legs, and I just couldn't stand. I couldn't tolerate standing more than about 10 or 15 minutes. I couldn't walk more than, say, a block without a lot of pain.
We call that neurogenic claudication. So is that any better?
That's gone. I have no problems.
Beautiful.
I have some weakness that's still recovering, but I have no pain.
Yeah, the weakness takes time because you've deconditioned and you're in therapy, right? And you're getting the right therapy.
It's improving.
And why is today special?
Today is special.
What are you getting rid of today?
No back brace.
No back brace. So you used this for 6 weeks?
I used it for 6 weeks.
And today is your 6-week
And
anniversary.
I'm happy to be rid of it.
Congratulations, sir. Go enjoy life.
Thank you very much.